Hello, my name is Shikha Patel Shah and this is HEENT Shah. And we are, or I am recording a video assessment for head, ears, eyes, nose, and throat for class NU 650 Advanced Health Assessment for Regis College. And for the purposes of an assignment video recording, would you consent us with recording your video for this assignment?
Yes.
Thank you. So let's get started. So I'm going to begin by assessing, inspecting your head. I am looking for any, if there's any tenderness or any, I'm looking for symmetry. I am looking if there is any lumps or any depressions or deformities, and I do not see any. Do you feel tenderness at all when I touch?
No.
Okay, and now I am looking at your face. I'm looking for the contour, and as you can see the facial expression, the patient seems very calm and composed. There is no involuntary facial movement. There is no masses or lumps noted, and the face is symmetric. I am going to start by assessing your eyes now. So I am looking right now at your eyelashes, eyelids, and palpebral fissures and eyebrows. And eyebrows seem well in line. And I am now going to just press down on your face. And can you look up for me? I am looking for conjunctiva, which is which is pink and moist, and sclera is white with some vascularities. There is no edema or no discharge. And now I am looking at your pupils, and they're round. They are about 3 mm on each side, symmetric, and I am looking for your lens and cornea, and everything looks equal on each side. We will start by checking for visual acuity. I'm going to stand about 6 feet away. And can you cover one of your eyes and read this line for me right here?
DHJBS.
And now cover your other eye and read the same line for me backwards.
SBJHD.
Great. And that checks for visual acuity. I am now going to check for reflective reaction of pupils to the light. I just want you to keep looking at my nose. Okay, so left pupil is reacting directly to light, and right one is constricting, also equally direct and consensual to the light. I'm going to repeat on the same side. Keep looking at my nose. Okay, left pupil constricting with direct light, and right eye is constricting consensually. And now I am going to just have you look at my finger for accommodation and then look back. Okay, so look at my finger and then look back. Look at my finger again and look back. Okay, I see that the pupils are bilaterally constricting when focusing on the near finger, and then dilating as looking away from the finger. So now we're going to check for your visual field. So I want you to cover one of your eyes, and now tell me yes when you see my fingers.
Yes. Yes. Yes.
And now cover your other eye.
Yes. Yes. Yes.
Okay. And now I want you to look at my finger, and I want you to follow my finger. I'm looking for extraocular movement. While I do this, I am looking for any convergence, nystagmus or lid lag, and I do not notice any lid lag or nystagmus. Okay, and now I am going to use this otoscope. I'm going to stand at 15-degree angle from my patient. My doctor is set at 0. I want you to keep looking straight and keep your eyes open. I'm just going to use my hand to steady, and I'm looking for red reflex. Okay, and I can see it. I can see the optic disc. I can see macula and fovea. No macular degeneration noted. I'm going to do the same on the other side, 15-degree angle. I see the red reflex. I can see the macula, fovea, and optic disc. No macular degeneration noted. Okay, and now we are going to check your ears. I am looking for symmetry or any, there's no deformity on each side. And now we are going to use our otoscope. And I'm also looking for the auricles along with the surrounding tissue. Everything looks intact. All right, I am looking into the tympanic membrane and ear canal. There is no occlusion, no foreign object. I can see the pearly gray tympanic membrane, no bleeding, no swelling, no discharge, no purulent discharge or drainage. All right, tympanic membrane intact. I'm gonna do the same thing on this side. I'm gonna pull it up and back towards me. And I can see that there's a little bit of cerumen, but no foreign body, no foreign object, or any discharge or drainage. Intact pearly gray tympanic membrane. All right. And now we are going to do a whisper test. So I am going to stand right behind you if you can cover one of your ears. And I'm going to say 2 words and tell me if you can hear them.
Apple green.
Okay. And then on this side.
Red robin.
Okay. All right. And now we are going to do a Weber test. And that is to check for lateralization of sound. Tell me if you hear it equally on each side or on both sides.
Yes, I do.
Okay. And now we're going to check for ear conduction and bone conduction versus and sound conduction, air conduction. Okay, so that's called a rain test. And tell me when you stop hearing the sound. Do you hear it?
No, I don't. It stopped.
But did you hear it?
Yes, I did.
Can you hear it?
Yes, I do.
Did you hear it?
Yes, I do hear it.
And now do you hear it?
Yes.
Okay, so as you can see that it is a positive rain test. Okay, and now we are going to inspect our nose. I'm looking for symmetry. There is no deformity, it's symmetric. I am going to, there's no lumps or masses. I am just palpating the nasal passage for any obstruction. There is no obstruction. I am now going to just look into your hairs. All right, I am looking for septal deviation, which I do see there is a slight septal deviation towards the left, but there is no blockage of the nasal canal. It is pink mucosa, a little bit moist, not dry, no bleeding, no lumps, no polyps, no nasal polyps, and no bleeding either. Okay, and I am going to now palpate your sinuses. So I'm palpating frontal sinus. Tell me if there's any tenderness.
No.
And now here?
No.
Okay. All right. Good. And now I am going to now look at your lips. They are moist pink, symmetric, no lesions, no lumps, no bumps, no ulcers present. I am now going to have you just open your mouth. And I am looking for oral mucosa, which is pink, moist. I do not see any ulcers. Could you lift your tongue for me for a second? Lift your tongue. Okay, no ulcers, no bumps, no bleeding, no, and yes, you can put it back down. And the tongue is moist, pink. There's papillae. It's symmetric. The texture is even. And can you say eh? Okay, I can see the uvula, which is midline and not deviating. And with the eh sound, the soft palate moves up and down. Okay, there is no ulcers or anything. Can you do eat for me? I am checking for tooth if there's any. So the teeth is even. There's no loose teeth. There is no retraction of the gums. There's no swelling of the gums. No bleeding. No ulceration. Everything looks intact. And that is it for us. Thank you so much.
Thank you.